After eliciting the history and the check of all system, we examine the child. We will have in this topic an introduction and the examination of the general health, vital signs, respiratory system, cardiovascular system, gastrointestinal system, genitourinary system, muscular and skeleton system, ears, nose and throat, and anthropology. A single routine will not work for all children. Gaining the confidence of the child and family during history taking will help. Convincing the child to let you examine him may be best done by the family. If the child is very ill, examination still needs to be thorough. There is no correct order. Be opportunistic. E.g., with younger children on a lap, listen to heart when there are gaps in crying. You may not need to examine each system each time. Talk to the child and explain what you are doing. Sometimes it helps to examine their toy. Wash and warm your hands. Encourage both parents to be present. General health. Is the child ill or well? Alert, lethargic, or uncomfortable, in pain? Playing is a good sign. If crying, is it high-pitched or normal? Behaving normally and interacting with the parents? Any jaundice, cyanosis, rashes, anemia, or dehydration? Neck stiffness is a rare sign in infants. Vital signs: temperature, heart rate, respiratory rate, BP, capillary refill time. Press on the sternum for 5 seconds. Capillary refill should be less than 2 seconds. Respiratory system. Is the shape of the chest normal? Any intercostal, subcostal, or sternal recession or nasal flaring? Use of accessory muscles. Is there grunting or any other audible noise? Breathing in, stridor, or out, wheeze. Percuss the chest for dullness. Auscultate the chest, listening for breath sounds, fine crackles, raunchy, wheeze. And pleural rub. Cardiovascular system. Check for peripheral and central cyanosis. Look for clubbing and peripheral edema. Compare strength of femoral and right brachial pulse. Is the apex beat displaced? Auscultate the heart with the child sitting and in supine positions. Listen over the apex, the second intercostal space to the left of the sternum, pulmonary valve, and the right of the sternum, aortic valve, and the fourth intercostal space over the sternum, tricuspid valve. Fixed splitting of the second heart sound occurs with an atrial septal defect. A gallop rhythm suggests congestive cardiac failure. Gastrointestinal system. The child should be supine and relaxed, with the knees bent. Look for distension, visible peristalsis, and hernias. Listen for bowel sounds. And percuss for hepatosplenomegaly and ascites. Palpate looking for tenderness and masses, during inspiration and deep expiration. Never perform a PR, this should be done once only and by a senior. If relevant, check for anal patency, fissures, and prolapse. Genitourinary system. If relevant, examine external genitalia for evidence of ambiguity, congenital abnormality, and size. Examine once only using a chaperone and maintain the child's dignity and privacy. Note Tanner stage. Musculoskeletal system. Watch the child walk and play. Examine all limbs and digits for congenital anomaly. Are there symmetrical skin creases on both thighs? If less than 6 months, check for congenital hip dislocation. Inspect the spine looking for dimples, hair tufts, masses, or cysts at the base. Is there any abnormal curvature or posture? Ears, nose, and throat. Always best to leave until the end with young children. Ask the mother to hold the child on their lap with one of her arms around the upper body and the other holding their head firmly against her. Is there evidence of otitis externa? Post-auricular rash is a sign of measles, rubella, and eczema. Look at the tympanic membrane using an otoscope noting color and lucency. Is it perforated? Use a spatula to check the tonsils, as well as inspect the teeth and oral mucosa, plaques, white patches, spots, ulcers. Can the child breathe through both nostrils? Is there a runny nose? Check for neck lumps and lymphadenopathy. Is there anything else the parents would like you to see or check? Finally, we check height, weight, and head circumference. Plot on centile charts. If you have any questions, let me know in the comments. Thank you for your attention. If you like this video, please share and subscribe.